I mean, the exposure is right there. You have to wash your hands. Stay home, stay home, stay home. If you do not have anything to do outside, if you are not going to work in the hospital or the clinic, or what is considered essential, such as, going, somebody, a pharmacist, the people that are working in the groceries, if you do not have any business out there, please stay home. Again, you have to wash your hands. You have to social distancing, like you just said. Social distancing is huge. Just because you are staying home, just because you have family members that are staying home, that doesn't mean that you need to have a barbecue. No, social distancing. You do not know who has what. Again, as I said earlier, some people do not even show any signs of
having the virus.
COVID-19, that they were exposed to COVID-19. Some people do not even know that they have it. Especially if that person's immune system happened to be a good immune system, maybe they have it and then it won its course without even them knowing it. So it is very important to understand that you have to maintain social distancing. If you are going to cough or sneeze, it is important to use a disposable tissue. Once you do that, you have, of course, disposable, then you have to throw it away. And of course, again, if you believe that you have been exposed, by someone who is positive for COVID-19, you have to make sure you let your healthcare provider know that, and they will guide you accordingly.
To the next steps. Okay, that leads to my next question. When should the person seek medical advice? Okay, so we talked about having several different types of symptoms, a fever, a dry cough, body ache, right? Some of the symptoms that people are feeling. Some people have chest pains. At what point should you say to yourself, I cannot, take care of this at home. I need to go to a hospital?
Well, I don't believe that someone should wait until the condition worsens. And that's the reason why earlier I did say that World Health Organization and the Center for Disease Control and Prevention recommend that as soon as you start showing symptoms, you have to call your healthcare providers. Remember, if you are exposed, most likely you're going to show symptoms from day 2 to 14 days. So if you see that let's say day 1, you started having a fever, you take it at home or you feel chills, whatever that may be, and then the next day it's the same thing. I suggest that you call your primary care physician, because your primary care physician or any of your healthcare providers, that could be a DO, an MD, a nurse practitioner, whoever that healthcare provider is to you. I suggest that you call your healthcare provider so they could guide you appropriately, because you do not want to stay home until your condition worsens, and that's when you have to call 911. And by the time you call 911, that's when all your organs definitely will shut down, because the virus
has taken over.
It will make your body work. So the idea is, as soon as you start showing symptoms, you have to call your healthcare provider, and they will guide you appropriately.
Wow. Another question. I know that as a healthcare professional, you are on the front line every single day, and this is what you are used to doing. You're used to sacrificing for the betterment of someone else. But right now we're in a situation where it is not just sacrificing time and being at the hospital, but now you are putting yourself at risk. How are you personally dealing with that? Just knowing that once you leave the house, pumping gas, going to the supermarket, and then possibly even going to work, all of that is putting you at risk. How are you dealing with that personally?
Well, Naomi, allow me to actually say thank you to the real frontline workers. Those are your environmental services that are cleaning those rooms of the COVID-19 patients after death or while those patients are there. The first responders, the ER nurses, the pharmacists that are actually working 24 hours at Walgreens to make sure that we get our prescription on time, the police officers, and I actually have my best friend who is actually working by testing those patients, this possibility of patients that may have COVID-19 in those different facilities. So allow me to say thank you, to those people. As a mom, as a nurse, as a human being, I'm concerned, I'm anxious, I'm scared just like anybody else. As a nurse practitioner, I see patients in the clinic. Half of my days is in the clinic. Mm-hmm. The doctor that I work with, half of the day is in the clinic, and then the other half of the day is I see patients in different hospitals where I have different privileges, especially when he is on call. So whenever I leave my house being anxious, okay? Because you can see a patient. I can have a consultation, or anybody for that matter can take care of a patient on Monday, and then on Thursday, that patient is put on isolation. Of course, you were exposed. So those things I worry about. But yet again, this is the type of career that happened to choose me 20 years ago, over 21 years ago. So anxious, definitely, because I'm a mom. Nobody wants to die early. Anxious because you want to care for your patient appropriately. And I also feel for those patients that are actually in the hospital bed. Now, remember, the hospitals, most hospitals do not accept family members to go and visit, only because they have to limit the amount of exposure. And as well as making sure that, they are protecting the PPE, the appropriate mask that they have for the actual nurses that are caring for the patients. So one thing I would say to nurses that are caring for those type of patients, knowing the fact that the family members cannot be there, I know as nurses that we give great care. I know as nurses that we are compassionate, but we could try to be a little bit more compassionate, because nobody wants to die by themselves. Nobody wants to die lonely.
Wow. And with that said, I was going to ask you to leave us some final words. And I guess, in a sense, you began your final words by asking the health industry to be a little bit more compassionate, because this situation is one that we've never gone through before, and it's causing people to die in isolation, and no one can really fathom that for their loved ones. We're going to take a break and come right back.